Multi-detector row CT scanning 1992. First helical scanners emitted X-rays that were detected by a single row of detectors yielding one slice per gantry rotation. This technology was expanded on in 1992 when scanners were introduced that contained two rows of detectors, capturing data for two slices per gantry rotation. Scanners with multiple rows of detectors allowing data for many slices to be acquired with each gantry rotation. Imaging planes. All the directional terms are based on the body being viewed in the anatomic position. Anatomic position standing erect, palm of the hands facing forward. Interior and vertical movement forward toward the face. Posterior and dorsal movement toward the back surface of body. Inferior caudal inferior toward the feet down. Caudal toward the tail or feet. Superior cranial cephalic movement toward the head up. Lateral movement toward the sides of body. Medial movement toward the midline of body. Distal away from and proximal close to. Both terms referring extremities like limbs. Distal movement toward the ends. Distal end of forearm is the end or end to which the hand is attached. Proximal situated near the point of attachment. Proximal end of the arm is the end at which it is attached to the shoulder. Horizontal or transverse plane. Parallel, longitudinal or vertical plane, perpendicular. Coronal plane divides the body into anterior and posterior section. Sagittal plane divides the body into right and left sections. Median or mid-sagittal plane, the sagittal plane that is located directly in the center making left and right sections of equal size. Parasagittal plane, it is located to either the left or right of midline. Axial plane, they are cross-sectional planes that divides the body into upper and lower section. Oblique plane, slanted and light at an angle to one of the three standard planes. The image plane can be adjusted by positioning the patient gantry or both to permit scanning in the desired plane or by reformatting the image data. Scanning in the desired planes produces better image than reformatting existing data. Although advances in CT technology have reduced the quality difference, changing the image plane in CT provides additional information. Changing the image plane from axial to coronal, it's indicated for two distinct reasons. Primary reasons: when the anatomy of interest lie vertically rather than horizontally. Example, ethmoid sinuses. Because the ethmoid sinuses tributaries turbinates lie predominantly in vertical plane. Images taken in axial plane show only section of anatomy, with no view of the entire ethmoid complex. Images taken in coronal plane is more suitable for displaying the ethmoid sinus structures and more readily show as obstruction. In case of sinuses, it is relatively easy to change patient position so that images can be acquired coronally. This practice is not possible with all areas of anatomy that may benefit from coronal imaging. The example, pelvis. Because the planes in the pelvis often run obliquely or parallel to the transverse plane, in some cases image obtained in coronal plane may be superior to those obtained in the axial plane. However, scanning in the coronal plane is not common because of the difficulty of positioning the pelvis. In this case, reformatting image data from an axial to coronal plane may prove useful. Second indication from scanning in different plane is to reduce artifact creating by surrounding structures. For this reason, the coronal plane is preferred for scanning the pituitary gland. In the axial plane, the number of streak artifact and partial volume effect are greater in coronal plane. Most scans are performed in the axial plane, but many HER protocols require coronal scan. Overview of CT system operation. X-ray photons are created when fast-moving electrons slam into a metal target. Kinetic energy, energy of motion of the electron is transformed into electromagnetic energy. X-rays are produced when a substance is bombarded by fast electrons. CT system. The components that produce X-ray beams are housed in gantry. X-ray tube contains filaments that provide electrons that create X-ray photons. This is accomplished by heating the filament until electrons start to boil off, hovering around the filament that is space cloud. Generator produce high voltage or kV and transmit it to X-ray tube. This high voltage propels the electron from the X-ray tube filament to anode. The electron and the area of anode where the electron strike and X-ray beam is produced is the focal spot. Tube current. The quantity of electron propelled is controlled by the tube current and is measured in thousands of an ampere, milliamperes, mA. Anode target. The electron then strike the rotating anode target and disarrange the electrons in the target material. Production of heat and X-ray photons, kinetic energy converted to thermal energy. The vast majority, 99% of the kinetic energy, greater than 99% of the kinetic energy is converted to thermal energy. To spread the heat over a larger area, the target rotates. Increase voltage, increase energy, increase intensity. Increasing the voltage increase the energy with which the electrons strike the target and hence increase the intensity of the X-ray beam. Intensity of X-ray beam is controlled by kVp setting. Heat capacity, the ability of the tube to withstand the resultant heat. Heat dissipation, the ability of tube to rid itself of the heat. Length and frequency of scans, determined in part by the tube heat capacity and dissipation rate. The X-ray photons that pass through the patient strike the detector, solid state scintillator material. If the detector is made from solid state scintillator material, the energy of the X-ray photons detected is converted to light. Photodiode element in the detector convert the light levels into electric current. Xenon gas in older CT system detectors are sometimes of the xenon gas variety. In this case, the striking photon ionizes the xenon gas. These ions are accelerated by high voltage on the detector plates. Data acquisition system DAS. Regardless of the detector material, each detector cell is sampled and converted to a digital format of DAS. View. Each complete sample is called view. Digital data. The digital data from DAS are then transmitted to Central Processing Unit CPU. CPU, brain of CT scanner. Reconstruction processor take the individual views and reconstruct the densities within the slice. To create an image, information from DAS must be translated into a matrix. To do so, the system assigned each pixel in the matrix one value or density number. Density number in Hounsfield unit is the average of all attenuation measurements for that pixel. Display processor. These digitized data are then sent to a display processor that converts them into shades that can be displayed on the computer monitor. CT process, creating CT image, three general segments: data acquisition, image reconstruction, image display. Image acquisition, get data; image reconstruction, use data; image display, display data. Data acquisition, obtaining data, acquire the information. X-ray photons are created and directed through patient, either absorbed or penetrate the patient to strike the CT detectors. Image reconstruction, the data are sorted so that each pixel has one associated Hounsfield unit value. It uses the information collected in the previous segments and prepare it for display. Image display final phase. The processed data are converted into shades of gray for viewing.